When medicines are not proving adequate, we now are fortunate enough to have a few other options. Epilepsy surgery is a long-standing option that's been done for nearly 100 years in the U.S., really, although mainly became popular in the 50s and 60s in the Western Hemisphere. Surgical techniques have changed considerably. There's been a real improvement, an evolution that's quite favorable in surgical technique in the last 20 years. I mean, I've seen this happen, and it's gratifying. Anesthesia has gotten much better, quite honestly. So the safety of surgery has actually significantly improved. The surgical techniques have been improved with the introduction of intraoperative neuroimaging as well. Surgeons now have the ability to take MRIs done preoperatively and use those in complex imaging platforms so that they can have probes in the brain and know exactly where they are. And again, it's sort of navigating around the brain, I guess is the way of describing it. It's called neuronavigation, which again helps them know better where they are, what to stay away from, which is, I think, significantly improved the safety of surgery. As far as specific surgical techniques that are new, the use of laser interstitial thermal ablation has really swept the country in the past couple of years. We at Jefferson, we've been using this for about 7 years or so, and the technique came out in the U.S. about 11 or 12 years ago. I think it was approved by the FDA in 2008, I guess. And this technique is a minimally invasive technique, as the surgeons would put it. So rather than having to do a craniotomy and take out a larger piece of brain with all the associated morbidity of that, now a surgeon can make a very small twist drill hole, insert a probe, and then a laser is turned on to heat the tissue around the edge of the probe. So in the setting of a small epileptic lesion, you can destroy that in a relatively non-invasive way. Practically, what does that mean? Practically, it means that people come into the hospital and go home the next day. For pain relief, they use acetaminophen. They don't need narcotics. And they can go back to work a couple of days later. I mean, I always smile when I think about an older woman that we did this surgery on, and I asked her how she felt. She said she felt fine. And I said, "What did you do when you went home?" She said, "Well, I went to the mall on my way home from the hospital." I mean, it's at that level as opposed to 3 days in the hospital with a craniotomy, significant analgesic, people out of work for 4 to 6 weeks. So some of these minimally invasive techniques, while still invasive, are far better than we had.